Birthing positions. In this first position, it is good to use when you're just beginning to have contractions that's just starting to become more intense, or they're still very mild. You're sitting on a chair with your legs open. Leave some room for your baby. Rock your upper body in a circular motion in both ways. You're relaxing the joints, ligaments, and muscles, but in a very gentle way. Not giving pressure on the knees and thighs because you want to save these energies. Remember to keep your back straight. Accompany this position with the 4-6 inhale and exhale breathing exercise, aka the de-stressor. Squatting. Some exercise help labor to progress and exercise the thighs. This is one of which that does it. You will need a chair and a pillow for you to rest on. Squat in front of the chair. Leave some room for the baby at your comfort. If you're in this position, you're usually not in much pain yet. Welcome to take some deep breath and relax your shoulders. This exercise focuses on the pelvic and thighs. Squatting can also be done with a partner supporting on your back as you do your breathing exercise. In this video, I'm leaning as if a partner is supporting me on my back. This position is also suitable for very early labor. Another good position to soothe pain as labor progresses more, the contractions becomes more intense. It is good to have all fours on the floor. Keep your belly down, legs apart. Let the gravity to drop your belly down. Keep the butt up and rock front to back slowly, very slowly. As you breathe, keep your head and chin up. This position can really help to relieve the tension building up on your spine. In more intense contractions, you will begin to feel a heavy tension on the lower back, and it may begin to spread up and down along the spine. This is my favorite position to relieve back pain. You may also gently rock your hips in circular motion. Of course, one position is not enough when women begin to feel pain. They will feel the need to move around. Find another comfortable position as labor progresses. If you have epidural already, you can also be sitting on the bed. In this example, I'm sitting on the floor. Sit up straight with your legs open, lean back, the feet touching each other, and rock your upper body. Accompany this exercise with the 4-6 distressor breathing technique. This pose stretches the pelvic floor and thigh muscles. I'm not sitting on a bed, so I'm not leaning back, so you can either do it sitting up straight or lean back. As labor progresses, women will be moving around a lot, testing to find the best position to relieve the tension. This one can be helpful. Prepare a towel and kneel on the floor with a chair and a pillow, or with an exercise ball. You can have your butt up and put your weights on the chair, drop the belly, rock the bottom and the hips area to gently relax the hips and lower back. Also accompany this exercise with the 4-6 de-stressor breathing technique. If you are tired, simply lean your body on the chair. Rest your head on the chair, legs open, and rest. Give some space for your belly. Relax your spine and back. Have a rest. When you're tired, you can go as simple as leaning forward on the back of the chair, chin up for better breathing. This position is probably very familiar to most of you already. Sleeping sideways. The only difference is that you'll probably need more pillows at the bottom to keep your legs apart and to accommodate your bigger belly. Place an exercise ball or pillows in between. With epidural, you can lean back on the bed. You'll likely be elevated like this. Keep your legs apart. Exercise the thighs. Stretch them apart. Very slowly. You may be losing the sensation already due to epidurals, but you can still do a little bit of movement. Exercise your thigh muscles and practice the Kegel exercise. If you're lying on bed with epidural, you can also stretch your legs with a towel. Frog leg position can widen your pelvis. Also accompany this exercise with the 4-6 de-stressor breathing technique. This is how you will be likely sitting on the hospital bed. Legs apart, your back is slightly elevated. Remember to drop your shoulders, keep them relaxed. Let both shoulders to touch the bed and relax. If you're giving birth in the hospital, it is very likely that you will be sitting like this. They will be holding your legs up on each side. And you will be lifting your head and looking down. Catch some time, try to do some breathing. Big breath. Long exhale. When you're ready to push, you will be asked to place your chin on your chest, touching your chest. And this is how you will push. Drop your shoulders. As you exhale, try to do that U shape. Listen to the doctor, he or she will tell you where to push. Remember, they can see what's happening down there, so they can let you know you're exercising the wrong muscle. When you're using the right muscle, give it more push, the baby will come out. In ancient days, this is how people give birth, usually in a squatting position. Squatting birth is once again gaining its popularity in the States. It is great for natural birth. It reduces the risk of tearing. It can widen your pelvis. It also increases the amount of oxygen to the uterine muscles and the baby. It puts less stress on your body, and it helps your body to contract more powerfully and efficiently. You may choose for this option at the hospital. Look at the picture here. It is possible to do a squatting position birth in the hospital, but if you have epidural, it can only be done in the first 20 minutes because you're losing sensation in the lower half of the body. Because of the epidural, your muscles will also lose the strength.